Hello, my name is Neil Maniar, and I'm the Vice President for Health Systems here in the New England Division, based over here in Framingham. I'd like to take a few moments just to tell you a little bit about what we do within the Health Systems team, and then talk about one of our signature initiatives, which is 80 by 18. The Health Systems team oversees work with our hospitals, community health centers, health departments, and health insurance companies around New England. We have over 90 different priority accounts with hospitals. We work with a number of federally qualified health centers addressing the needs of patients and their families who are from underserved populations. We work with transportation and lodging programs. We have patient navigator programs in 10 different sites around New England. And we also do a lot of work around screening and early detection. The health systems team has 4 different verticals, I guess you would call it. The primary care systems team that works mainly with primary care associations and community health centers. The state systems team, which works with health departments and insurance companies. Hospital systems team that, as you would guess, works with hospitals, but they also oversee our patient navigator program. And the mission delivery team, which is a small but mighty team that delivers our programs across all of these different settings. So that's a little bit about what we do in the health systems team. So now I'll take a moment and tell you a little bit about 80 by 18. 80 by 18 is a signature initiative for the American Cancer Society in partnership with the National Colorectal Cancer Roundtable. The goal of this initiative is to reach an 80% colorectal cancer screening rate by the year 2018. So why is this important? For a couple reasons. One, colorectal cancer is one of the most lethal forms of cancer if detected late. However, unlike so many other types of cancer, we have the ability to prevent colorectal cancer. We have the ability to detect it before it even becomes cancer. And that's where screening comes in. Screening for colorectal cancer is highly effective, particularly in terms of colonoscopy screening, which is the gold standard. By reaching an 80% screening rate for colorectal cancer screening, we have the ability to save over 160,000 lives by the year 2030. Right now, colorectal cancer, again, a cancer that is preventable, is the 3rd leading cause of cancer-related deaths among men and women in this country. Take a moment to think about that. We can prevent colorectal cancer, and yet it is the 3rd leading cause of cancer death. So our goal is to knock it off that list. How are we going to do that? We're going to do that by partnering with a number of different community partners, not just hospitals, health systems, community health centers, and health departments, but corporate partners as well. We're working on getting CEOs of organizations to sign a pledge to commit to creating a culture that is supportive of screening. We are working with hospital systems to help them figure out how they can improve screening efforts and how we can partner with them to advance these efforts. We're working with community health centers to make sure that we open up screening programs to underserved populations, and working with health departments and insurance companies to send out reminder cards so that people know that their screenings are due. These are just a couple of things that we're doing around 80 by 18, but there's much more to come. What we do know is that here in New England, one of our 6 states will be the first to reach the 80% target. Why is that? Because 5 of the 6 New England states are actually in the top 5 in the country for colorectal cancer screening. All 6 are in the top 10. Massachusetts, for example, is just a few percentage points away from this 80% target. But that last little stretch, that gap that we have to bridge, is going to require a lot of effort. It means that we're going to have to identify and address disparities. We're going to have to reach out to all of those people who feel pretty good and feel like they don't need their colorectal cancer screening, but they do. And we're going to need to make sure that we open up access to colorectal cancer screening to all of those who need it, making sure that for those individuals who don't want to get a colonoscopy or who can't get a colonoscopy, that they know that there are other good alternatives to screening as well. Because in the end, the best type of colorectal cancer screening is the one that gets done. That's our vision, our commitment, and our goal as a division and as an organization to achieve by 2018.